So here is the prenatal environment, what we talked about earlier. And the placenta, of course, is here where the child is going to feed. And this is really important for understanding the effect of teratogens, which we'll talk about when we get into that area here. So if you look here, this is, again, the amniotic fluid, the placenta right here. And this is going to form next to the uterine wall. There's a membrane. See the membrane right here. And that separates the mother's blood from mixing with the child's. So again, nutrients and toxins, unfortunately, can pass through this membrane into the child, and where it meets is on what we call the chorionic villi. Chorionic villi are these vessels that are in the outside the umbilical cord that are going to pick up all the nutrients and toxins that the mother ingests. And then, of course, they're going to in through the umbilical cord and into the child for nourishment or for, something adverse, if that's the case. So when we are testing, I'm going to be talking a little bit later about amniocentesis and chorionic villi sampling. And amniocentesis, of course, would take a sample of the amniotic fluid to detect any abnormalities that are occurring in the developing child. So you can detect all kinds of things, Down syndrome or multiple sclerosis or anything that you want to test for can be done with the amniotic fluid. But the problem is it can only be done at a certain point in time, and I'll talk about that when I get to it. Another way to do this is take a sample of the chorionic villi, which is right here, a plug of these vessels. And this is not taking the amniotic fluid. This is actually going into the cervix or the abdomen and taking a sample of the actual blood vessels here, a plug of the placenta, really. And they can do testing on that. It's better in that you can have it performed earlier, and you don't have to wait very long. So again, I'm getting ahead of myself, but just so when we go to talk about that, you know what we're talking about. So again, the issues can also happen with the developing child, which we'll talk about in another lecture. The umbilical cord has to be in a certain position. If it's wrapped around the child's head or if they're breached in the wrong position, this can result in encephalitis, or it can result in the child suffering from hypoxia or lack of oxygen, actually having a stroke. If that causes duress in the child. So all these things, again, have to go very, very smoothly, and of course the mother is monitored very closely throughout her pregnancy for any of these kinds of abnormalities. And things like position, and of course the umbilical cord, and if the child is breached, that can all be detected with simpler ultrasound could detect that. It's only when you have to look at more genetic types of issues that you would have the amniocentesis or the chorionic villi sampling. So we'll talk about that as well.